Welcome to Driven, the Unscripted Success podcast, with your hosts, Mike Manino and Nariman Hamden, bringing you insights and stories on achieving personal, professional, and financial success.
Hey guys, I'm Nariman Hamden, and this is Driven Unscripted Success podcast. You can follow us on YouTube, Spotify, and Apple. We've got an awesome guest on today. We have Dr. Alejandro Badia, and he has his MD, FACS, in hand and upper extremity surgeon. He's an expert in this, and who was educated in physiology at Cornell University and obtained his medical degree at NYU. He trained in New York City. He undertook a hand fellowship at a hospital in Pittsburgh and followed that with an AO trauma fellowship in Germany. How you doing, Doc?
Fantastic.
It's good to have you on. Where are you zooming in from?
So I'm in Doral, Florida, which is just west of MIA Airport, which is actually fortuitous for me because I see a lot of patients from abroad internationally. So I'm literally next to the airport, and I've been practicing in Miami 30 years.
That's fantastic. So why don't you give us a quick snapshot of your business, what you do and what your company does?
Yeah, thank you. So it's interesting when we use the word, the term business related to healthcare. It's very challenging because it's one of the few businesses that the person receiving the service often doesn't pay for, right? And we have this monster called the insurance industry, which unfortunately stands in our way. So I realized many years ago that the way patients were accessing me as a hand surgeon was very inefficient. They were going to emergency rooms, general urgent cares. So I started something called OrthoNow. So you can call that a business, and I can publicly announce that I just closed on the transaction 3 days ago.
Fantastic. Congratulations.
Thank you.
That's exciting.
I'll confess it's a little anticlimactic because the bureaucracy of medicine, even though we signed a purchase agreement on New Year's Eve, what are we in August? And I needed a number, a clinic number from the state of Florida transferred to the new buyers. And it took 5-6 months to get that. So this is, so if people, your listeners are wondering, why is it so inefficient to be able to see a physician and go to a specialist like me? It's because there is just way too much bureaucracy. So I've experienced it with OrthoNow. The other, business I have is my surgery center. I proudly haven't done surgery in a hospital in 15 years. I used to be chief of hand surgery at Baptist. But most of my cases were in an ASC, ambulatory surgery center. But when I built my own here in Doral, I basically do everything here. And then we also have therapy. So there's a lot of different components to be able to deliver care under one roof. So basically all the care that I give, as long as it's geographically feasible, we can do in one place. My MRI machine is right through that wall.
Oh, that's nice.
So patients are not run. So somebody comes with me with shoulder pain. We just inaugurated the Miami Shoulder Institute is also housed in this building. So when a patient comes to me with a shoulder, in fact, somebody just came out of the MRI, a lady from the small island of Bahamas. They have actually no health care there. I mean, literally, they're like lobster fishermen or something. So she can come here, get my physical exam, get a plain x-ray. Then I can get the MRI if I need it. Now we're actually, as soon as we're done, I'm going to inject her shoulder because she needs a replacement, but she wants to buy some time because it's after season. So she'll buy some time and she'll come back to Miami, but she'll never set foot in a hospital. And that is really the crux of my, business.
That's fantastic. So it's a one-stop shop hub for anything with, our limb related, arms, shoulders, and I mean, it's nice that you've got the MRI there as well, where you don't have to write them a script to go and get an MRI somewhere else, which will take weeks or months, and then they got to come back. And
they have to come back for me to interpret. So I'm glad you mentioned that because I wrote a book, and in my book, I talk about a case of a lady with Medicare, right? It's our national insurance company, right?
Yeah.
Literally sitting about 12 feet away from the MRI machine, excruciating pain. I can't do it. I can't do the MRI here on a Medicare patient. Don't ask me why. That's what my administrator says. And the lady has to go elsewhere. So she is one case that I mentioned in my book as a example of how broken our healthcare system is. And
Sure.
our solutions right under our nose, and yet we can't get the bureaucrats to look at it and work with us.
Right. It's inefficient.
Yes,
It's the steps are backwards,
exactly.
you know, which wastes.
In the best country in the world, right? Let's face it.
Right.
I mean,
Right. Which
yeah,
is just a complete waste of time and money, you know.
exactly. Time is money. So when as you astutely noted, when that patient has to go elsewhere to MRI, then they have to come back because they have to make a decision. Already, that's more money for, in this case, Medicare, right? You and me are paying for that.
Sure.
Right?
And not
So-
to mention they're taking double the time off their job in order to do this rather than, I mean, your machine's right behind that wall, like
Crazy, right?
not just have them go do it and then carry on, you know?
Well, that's why, I was honored to accept your invitation. But honestly, I have a vested interest in patients learning about
Sure.
this in society, because healthcare is 20% of our economy. It's not
Absolutely.
sustainable.
Yeah.
We could use half that money to improve our public education system, or the less fortunate in our society, right? We have to have
Sure.
safety nets, but there's a lot of money being taken up by all the middlemen in healthcare.
Yeah, absolutely. So when you think back, are there any moments that you'd say really changed the game for you in your career?
Well, when I co-founded something called the Miami Hand Center, it eventually grew to 5 and the group disbanded. But I will say that was pivotal, because I realized in that center that I didn't need to depend on the big hospitals, right? So when somebody asks me what I do, if I'm at a social event, orthopedic hand surgeon. Oh, well, what hospital? I said, well, why are you assuming it's a hospital? Right. So what I learned with Miami Hand Center is that what we could do outside a hospital. And that has really driven my career, is trying to practice medicine in a more efficient, personal, and cost-effective manner.
Sure, sure. So how do you deal with taking risks? Is there a time when you rolled the dice and it really worked out for you?
The reality is that each of the steps I've done, and I mentioned OrthoNow, right, is that, yes, it worked out for me. I took a major risk, but I will say I've learned that it's all about the people. Meaning, if I had, for example, along the way, let go, and I've learned this by reading, Elon's book or Steve Jobs' biography. I've learned that these were guys who had no qualms about firing people. And us physicians, we're not hardwired that way. But I look back and I say, geez, I should have done myself, the business, and that person a favor by really letting them go earlier. That would be the one thing I would do different. But overall, I'd have to say that each time I went on a limb with something in healthcare, for the most part, it eventually worked out. What's frustrating is it could have happened a bit faster. And that is the one thing that I wish was different, but it's ingrained into the whole healthcare bureaucracy. And if we really want to change that in this country, we're going to have to look at that critically, because there are just way too many people interfering with the decisions of physicians, nurses, techs who really know healthcare. We don't need all these layers.
Right. All these middle people that paper pushers. And not taken into consideration that the focus of all of it is the patient.
Exactly.
And that getting them the best treatment as quickly as possible so they can recover and continue on with a productive life,
Exactly. So, but along the way, that's exactly right. But along the way, if you do that, you actually save a lot of money.
Yeah.
So, I have a podcast, which right now, by the way, Nariman is quiescent because I don't have the penetration. So my IT guy says I'm shouting into the wind. He's probably right. But in my podcast, I've invited some amazing guests. I mean, U.S. senators, congressmen, former HHS secretary.
Sure.
And so I asked them, what are three initiatives that the top three initiatives to really improve our healthcare system and make it more efficient and cost effective? So then I tell them my three, and my three are the same every week, right? So one is, as you just alluded to, right specialist, right time. If you see the right person in a prompt manner, you save money and you get them better care. The second one is minimize this pre-authorization thing. You should have oversight, meaning there are, doctors who are maybe either not good or maybe not doing something, right. And we need oversight, but you don't need this authorization nonsense every step of the way when delivering care.
Sure.
Right? And then the third initiative for me is education, public education. So that's why I wrote a book. That's why, I accept a podcast invitation, because until the public realizes what the problems with our healthcare system are, we can't fix it.
Right. Exactly. Your hands are tied until everybody starts speaking up and petitioning for it, and lobbying for it. So what's a skill or habit you think doesn't get enough credit for contributing to your success?
What's a skill
or a habit that doesn't get enough credit for contributing to your success?
Well, in my case, really, my DNA is that I'm very open, and that can be a detriment, meaning that many times I will, accept a meeting or a discussion with somebody that really I'm going down a rabbit hole. So, but at the same time, that did contribute to my success. One of the things I've noticed with my colleagues is they're often not very open to suggestions and change. And that has allowed me to think outside the box and do things a bit differently. And I, in my own definition, be successful.
Sure.
A lot of people don't do that. And I've noticed that because we are, for example, going through some strife right now with our surgery center. And it's very hard to get my colleagues even to, say, answer an email. Whereas me, I mean, if somebody wants to reach me now, I mean, after this, and they go to drbadia.com, I will probably answer within hours.
Right.
It says right on my homepage, says, ask Dr. Badia. And to me, if you are not that responsive, you're going to be missing a lot of opportunities.
Yeah, I absolutely agree.
Yeah. Now, at the same time, the opposite that I wish I'd done more of, and I would tell any physician, is take a basic accounting course, a basic business course. You put a P&L under my nose, I mean, I just freeze. Or worse, a legal contract. So those are things that really us physicians need to learn much more about. And I wish I had done that early in my career.
Sure. And I can understand that and see that. So staying on top of any field is tough. What's something exciting you see on the horizon in your industry, and how are you getting ready for it?
Well, we have to bring up the elephant in the room, right? AI. I mean,
yeah, there we go.
Somebody sent me a video now about a hospital in China where I think they're seeing 3,000 patients a day.
Jeez.
With robots. So
Wow.
now I want to look into that because, in the end, when you get diagnosed with a malignancy or a loved one, you really don't want to hear that from a robot.
Right.
There is a special place for healthcare, but there's no question that in terms of diagnostics and being able to assimilate a large amount of data, and in imaging studies, AI will be a huge tool. Yes, in some areas we may be a bit displaced, but I see it as a helper tool. When I went into practice, we didn't have this. When I trained at Bellevue Hospital Trauma Center, they wanted to reach me. It was a beeper. And now we have a phone that we also have information right at our fingertip.
Sure.
I don't see that as a negative, and I don't see AI as a negative. But, I did read Nexus by Harari, one of my favorite authors. And Nexus talks about the pitfalls that we have to be careful with AI. So there's no question that, humans have to control the progress. So I think that's exciting. And I also think in the field of orthopedics, that regenerative medicine, meaning what I call orthobiologics. So this means platelet-rich plasma, PRP, growth factors, stem cells, being careful because a lot of people are, I would say, opportunists, are doing a
Sure.
lot of injections of stuff and charging a lot of money when there is not data that supports it. So it's very important to do this in a responsible manner.
Sure. I had a guest on last week that he is in pharma. He basically does clinical trials for pharmaceuticals and whatnot. And we spoke in detail about stem cell, and the state of Florida just approved stem cell treatments here. So now people can come
I'm gonna
down
look into that because
Florida.
I do something called lipogems, which is adipose. So we take the fat. We can do it in the office as a procedure. But there's other options that are actually a little where you don't have to take the fat and you still get the benefit, because what the benefit of stem cells is that it brings the growth factors you need to heal. It's not that the cell miraculously goes and creates a new rotator cuff. And those are the myths in medicine that I'd love to really dispel, because patients are often spending a lot of money for this stuff and not understanding what the limitations are.
Sure.
Well, you
Sure.
also had another guest, by the way, who's a medical writer. I listened to that with Mr. Brian Bass.
Yes, he's wonderful.
So one of
Yeah.
the things I'm really passionate about is educating the public about these sort of things. And because I can tell you, it's not coming, at least I've had no success in, the New York Times or the Washington Post. I mean, things that are really widely read. When you look at the medicine there's just not a lot about this being written and
Yeah.
by clinicians who are really in the trenches.
Sure. Yeah. After we stop recording, I'll share with you a few other things he said off the record that were pretty fascinating. That I think I'll have to put you two in touch. But yeah, he's seen, he's read, he's written quite a bit on a lot, and knows a lot, knows the industry and the start and where it's heading now and what they're doing, and so it's pretty interesting. But I'm sure leading a team has its challenges. What's your leadership style, and can you give us an example how it helped you through a tough spot?
Well, my leadership style is a little bit too laissez-faire. I alluded to that before. I think part of the problem is that I kind of assume that people will do the right thing. One thing I try to teach my two teenagers is about integrity.
Yes.
Integrity is, doing, and they'll roll their eyes and say, "Hey, Dad, yeah, integrity is doing the right thing when nobody's looking." But that to me allows me to really sleep well at night and look at myself in the mirror. And while I'll make many mistakes, at least I know I'm trying to always do the right thing. And the problem is when you're managing people, and believe me, I've tried reading the business books and management. They definitely have helped. But in the end, it's ultimately your DNA, and that's why when people say, "Oh, Badia, you're a really good businessman," I go, "I'm a much better surgeon than I am a businessman." A good businessman will be able to be a little more objective and make decisions. So that's been something that honestly has held me back. In terms of my style, though, is I try to be collaborative and try to really set by example. So, we have a great team here in my office. Most of my employees have been with me the whole, 15, 16 years. So to me, that's kind of indicative that, we're doing something right.
Doing something right if they're still around.
Yes.
So that's great. So when you're building your dream team, what's the one trait you look for and why?
Passion, understanding what we're trying to do and really caring. I mean, this is what, the other night it used to be commonplace, but we had the other night I was with my partner, Dr. Peterson, and I had 12 cases, he had a few, and we were here till 10 at night. And for example, I have a a person named Susan who sets up the international patients. So she's very accessible to them because they have to fly in, but
Sure.
she'll stay till that time. If the patient happens to be somebody from abroad, she'll stay and greet the family in the recovery room along
Wow.
with me. I mean, that is not something you're going to get really in most big hospital systems. I mean, that
Yeah.
personal touch, and that's what we kind of try to inspire in our team. And I think if you were to look at our reviews, I mean, in the end, I hate to say that, we're going to be judged like a restaurant, but for the most part, the reviews, people will comment on the staff, and I'm really proud of that because they're not usually going to understand my any surgical prowess to techniques I use different than others. They're not going to.
Sure.
They're going to understand how they get treated as people, as individuals, and
Right.
we take a lot of pride in that.
Sure. And that makes a big difference. I mean, this is a very vulnerable and important point of their life, and they don't understand all the terminology, and even if you know, uh, make it more in like just simplified terms, uh, so people can understand, they still don't understand. But when you have that like person there that's welcoming them and holding their hand and walking them, this is what's going to happen next. You're going to be fine. You're going to, it makes all the difference, because they
So it's
feel,
a huge difference.
yeah, it's building that trust in that vulnerable moment, and knowing that they're not just going to be, once they check out, it's over and done with. And once they check in, it's like, here's your gown. We'll see you in an hour,
Yeah,
so
no,
it makes
and
all the
in fact,
difference.
with our international patients, that relationship often continues. They often come to
Yeah,
Miami if they're coming here for shopping or for something business. They'll stop in and have a cup of coffee, and so that and in fact, it's very critical for what I do that I have relationships in these other countries, and typically with therapists, right? So when I do a rotator cuff repair or shoulder replacement or some type of wrist surgery, I need to be in communication with the person. So just now I sent some photos to a therapist in for a patient of mine from Barbados. And this lady is actually in Savannah, Georgia, because she's originally from Trinidad. So she's doing tele rehab. So we're actually doing like this. She's actually doing rehab through Zoom.
oh, neat.
So that communication is really critical.
Sure, absolutely. So how do you encourage your team to think outside the box and bring new ideas to the table?
Well, for example, required reading here is a book. I'll give a shout out to author Richard Shapiro. He wrote a book called The Endangered Customer.
Okay.
It's basically 8 pillars of customer service, and we've adhered to that. We also a few years ago read as a group read a chapter at a time a book called Beyond Bedside Manner. So it's sort of like the first book, but more focused on healthcare.
Sure.
And they talk about tips and pearls. So again, customer service is really paramount here, and I think the whole team has that. And it's one of the things that we're trying to do with OrthoNow. What I've tried to do. So as I hand the keys over to this group who's going to expand it, I'm going to tell them that I want OrthoNow to be thought of as a Four Seasons. The business books I read,
Yes.
they hold Four Seasons up, or Chick-fil-A, right? In terms of fast food, Chick-fil-A
Sure.
is known for that. So that's what we want to do with OrthoNow.
So you're going to be the Chick-fil-A of ortho.
Exactly.
I love it.
Exactly right.
I love it. So what's a day in your life look like, and how do you juggle work and everything else?
Well, it varies a lot. For surgeons, you have to remember there are office days and surgery days. For my primary care colleagues or internists, they kind of every day is office, and then they also go to the hospital, right? Now,
Sure.
my day, fortunately, does not mean looking for parking at a hospital anymore. And I did that. At one point, I was covering 12 hospitals in Miami with our group.
Wow.
So
Oh, nice.
depending on like July 4th was a nightmare for me, right?
Yeah. Yeah. And
M80s,
especially in Miami.
M80s, fire, and hand injuries, right?
Mm.
So so that was a big deal. So now, my life professionally is actually a lot more streamlined because it's really only here. So there are office days are, I start seeing patients at 8 a.m. till we're done. Because I went out of network 10 years ago with commercial insurances, I see less patients. The average patient who calls here goes, "Oh, he doesn't take my insurance," click. Okay, that just means I get to go home earlier.
Right.
Then there are patients who say, "You know what? I heard he's very good at wrist arthroscopy, and a lot of people in Miami don't do that. So I'm going to pay something out of pocket."
Sure.
Those days, depending on how many patients, new patients see me, that will determine my patient day.
Sure.
Then the other days are, I cut skin at 7:30. I run 3 operating rooms. So there is no wasted time. I have an incredible PA, right, physician assistant who works with me, helps me close wounds, put dressings on, and I move to the next room. So those days are extremely efficient. And then I make time to exercise. I ride my bike a lot. Now I've had my own orthopedic surgery, so I don't run anymore. I used to run, not marathons, but I was a regular runner. So now I cycle more. I work out, and I've gone back to tennis. I took up tennis at 50 because I treat all these pros, and they always ask me if I play tennis, and I felt ashamed to say no. I do not golf. It takes too long. And then my 2 passions, I would say, outside of that is travel and boating. So I am a boater. I came to Miami from New Jersey and New York because I envisioned a lifestyle of boating. So I'm a big boater.
Yeah, same here. I mean, how can you not be if you're living in Florida?
Yeah,
Boating, fishing, diving. I mean, what else do you need?
exactly. So
That's
and eating.
awesome.
My passion is going on the boat and grilling and eating there and actually, occasionally a glass of brandy and a cigar occasionally,
There you go.
yeah, so,
The trifecta right there.
exactly.
That's awesome. So you did mention books that have changed your outlook and approach on life and your business.
Yeah.
But has there been a podcast or someone that's really changed your outlook or approach as well? Besides your podcast and mine.
Yeah, I gotta confess, I don't have any podcasts I listen to regularly. There is one, I'll give a plug to my colleague. It's literally called The Ortho Show. And Scott Sigmund is a friend and colleague up in Massachusetts, and he interviews mostly orthopedic surgeons and gets them to talk about their childhood, what inspired them to become orthopedists, and then their particular focus in that field. And I like that because it gives me some ideas, and it's always great to learn from colleagues. So I would say, but I spend much more time reading. I read a book every 2 weeks. I'm starting one because I'm lecturing in Brazil next week. So one of the new people in OrthoNow told me about a book, River of Doubt, and it's about Teddy Roosevelt going down the Amazon.
Oh, neat.
So I'm going to the Amazon. I'm going to the first time I go to a city called Belém in Brazil. The Brazilian Hand Surgery Society is meeting there. I'm an invited speaker. And then so I'm going to read that. So I like to get my knowledge from reading nonfiction. And I noticed that Mr. Bass on his interview said that he reads and I do. I really don't read fiction anymore. I'm not knocking it. It's just that to me, life is oftentimes stranger than fiction. So I might as well learn something that actually happened.
Yeah.
I read Isaacson. I've read most of his biographies. I'm starting Benjamin Franklin, probably when I get back from Brazil. And then I've mentioned Harari. I like also Malcolm Gladwell.
Sure.
I'm a big reader, but I combine that when I go boating. I'll sit down and read for 2-3 hours.
Oh, that's nice. Nice and peaceful.
Yes.
So how do you tackle learning new things, especially stuff that's way outside of your comfort zone?
Usually ask somebody who knows more about it than me. I mean, one thing is reading about it, and now, I mean, even in surgery, I mean, there's YouTube videos. There's something called ViewMedi. So I have a bunch of videos that I've submitted to ViewMedi, but ultimately, you want to speak to a colleague. So last night, I'm treating right now a world boxing contender, middleweight kid. Complicated story, but I called a colleague of mine from Connecticut, and he has much more experience in this particular procedure. So it's actually one of the rare patients I'm referring out. So I'm gonna meet with that boxer and his trainer in the next hour, and we're gonna talk about him maybe going up to Connecticut. So
Wow. Yeah.
but that comes from that dialogue, and that's what I mentioned at the beginning: is being open-minded.
Sure.
I know what I know, but I also kind of know what I don't know.
Right.
And I think that part is very important, particularly for a physician. When there's occasional cases where you say, I don't see or do a lot of this, let me speak to my colleague.
Right. It's being able to know what you're capable of and what you need help with.
Exactly.
Asking for help. Well, you brought up business and finances and all that stuff, so it's going to lead me to this question. Obviously, it sounds like things are going really well for you and your business. So, as you're looking towards the future, I'm wondering how or if you've ever created passive income, or if you've invested in the past.
Not as much as I should. What I have done, and I will tell you, I was one of the early people interviewed in that. Have you seen the School of Hard Knocks on Instagram?
I have not.
Oh, these guys are amazing. They have a couple million followers now, and they interview. They go right up to you on the street and interview somebody that they perceive as successful. Well, now they're doing celebrities, and now it's a little more staged. But I was walking in a design district in Miami, which I rarely go to because it's super expensive. But I'm with my teenage son. And I step off the curb and this guy comes up at me. And like I said, I'm very open. So,
Yeah.
can you answer some questions? Yeah, sure. He goes, tell me about your business. And then at one point he goes, what's the most money you ever made in a year? Like, just like that.
Just
And,
like that.
But he asked me for advice. And I will tell you, this is a form of passive income, is that early on, I learned to invest in with a broad portfolio of equities and bonds, etc. Now I do a little bit investing in some private equity companies, and the power of compounding interest is unbelievable. So anybody young listening in, and my son's learning. My son literally just said he's just turned 17. He's going to put some money made over the summer, and invest it and put it away in a Roth IRA. I'm like, son, you're 17, you're thinking about a Roth? Yeah, but dad, if I put in just a 2,000, it'll become almost $1 million. And he's right. So
Yeah.
I think doing that, in terms of real estate, I have a colleague who's a hand surgeon who's doing mostly investing in real estate and in particularly like buildings, apartment buildings,
Multifamilies.
Yeah, exactly. And again, I don't know a lot about that, just like I don't know a lot about crypto. So I've not put my money in at this stage of my life. I'm not going to do that. But certainly, those are ways to create passive income. For me, it's just been investing. I have a offshore account in Switzerland for many years. I have several financial advisors who manage accounts. And I used to I had a brokerage account. My dad managed that for me. No comment. So it's better that, even though my dad's a very smart guy, he doesn't know when to get out. So you have to take money off the table, right? Buy low, sell high. So I have professionals who help me with that, and they've been great.
That's awesome. That's wonderful. Well, as we're wrapping up the interview, what plans or incentives do you have for the next 6 to 12 months? What do you got going on?
Well, I'm going to help the new OrthoNow team get off to the right foot. I mean, obviously, I want to be focused on the medical part. That's my strength. They're going to be much better than I at the business part. So we have high hopes to see OrthoNow expand significantly in the next 12 months in Miami, and then go to other markets. We're looking, for example, in Texas. By the way, I expanded my practice to New York, so I operate in Manhattan because I trained there, spent a decade there. So I operate in New York City for patients who, want to see me from the New York area. I'm there about every 5 to 6 weeks. I'd love to see OrthoNow go into New York because right now there's a few urgent cares that are like on every corner, but the public doesn't realize you go into general urgent care, you're probably still going to be referred to somebody like me. So let's start the journey a little different. So that's what I'm going to focus on. Getting my partner ramped up. He's only been in practice a year now, and then I'm going to do what I really love professionally is doing medical missions. So I'll be doing more. I was doing surgery in Bolivia earlier this year. I'm supposed to go to India. So going probably 2, 3, 4 times a year, going and doing free surgery on people who otherwise would have no access.
What a great public service you're providing there, and just very charitable. My ex-father-in-law was a endodontist, and he would go to Haiti. Wow. It was one of his biggest places, and take his entire team there for the week, and all they would do is root canal surgeries.
Wow.
The entire time there. So, I mean, just like 12, 13 hours a day. Just yanking.
Well, that's kind of related to, you probably heard of Operation Smile, right?
Okay.
So they do the cleft lip and cleft palate.
Yes.
And I met after a very inspiring lecture, I went and I invited, I said, hey, this was in Hawaii at a conference. And I said, Dr. McGee, do you have time to have a beer with me? And we sat down, we had a couple beers, and William McGee, and he's the founder of Operation Smile. And that was very inspiring to me.
Yeah, I did hear about that. I do the
same thing. Obviously, we do the same thing in the upper limb, which if you think about it, people don't realize about the field of hand surgery, but there's a huge economic byproduct. I mean, when people think orthopedics, they always think, $1 million athletes and knee injuries, ACLs, but you make a living with your hands, mostly, right? So if you don't have a functioning hand, if you're a laborer, you're going to have trouble feeding your family.
Sure, absolutely.
So there is an economic impact in cultivating hand surgery for every type of society, whether a developing nation or Western world.
Yeah, absolutely. Well, if someone wanted to connect with you, how does one get a hold of you?
The easiest way really is my website, drbadia.com, drbadia.com, and I promise you will get a very prompt answer. I'm obviously on the social media. It's pretty much at Badia Hand on Instagram, TikTok, all those things.
Awesome. Thank you so much for coming on. It was truly a pleasure chatting with you. You're very enthusiastic and very passionate, and I like your openness. So that was fun.
I do want to give one little, because I'm interested.
Sure.
I didn't have it nearby, but here it is. So this is my book, which I am very interested in the public being aware of this, because it talks about the problems of healthcare delivery for somebody like me, who is still in the trenches. I have patients now in the exam rooms. So, I'm not I'm not some pundit. I'm a surgeon who knows what the problems are with the healthcare system. And the book talks about that. So I'd love to hear more engagement from people. And please, I want criticism. I can take it.
Yeah, bring it on, folks. Bring it on. Well, thank you so much. And thanks for tuning in, guys. We'll see you next time.
Thanks for listening to Driven, the Unscripted Success Podcast. Want to share your story? Apply to be a guest at drivensuccesspodcast.com/guest.